Cardiac emergencies are life-threatening and can happen at any time to a victim of any age, on land or in the water. When a person is in cardiac arrest, quick action is crucial. The cardiac chain of survival describes 5 actions that, when taken, increase a person's likelihood of surviving cardiac arrest. There is a cardiac chain of survival for adults and a cardiac chain of survival for children and infants. Let's take a look at the cardiac chain of survival for adults. First, there is recognition of the emergency and activation of the emergency response system. Then, early CPR, followed by early defibrillation, advanced life support, and integrated post-cardiac arrest care. Lifeguards and the safety team play a major role in completing the first 3 actions in the cardiac chain of survival. The first link in the cardiac chain of survival, recognition of the emergency and access to the EMS system, gets help on the way quickly. The sooner you recognize that a person is in cardiac arrest and summon EMS personnel, the sooner advanced medical personnel will arrive. Early CPR is the second link in the cardiac chain of survival. CPR helps to circulate oxygen-rich blood to the brain and other vital organs, helping to prevent brain damage and even death. The third link is early defibrillation. The electrical shock delivered by an AED may help reestablish an effective heart rhythm, significantly increasing the person's chances for survival.
Analyzing rhythm. Everyone stand clear. Shock advised.
The fourth link is early advanced life support, which is provided by EMS personnel at the scene and on the way to the hospital. Integrated post-cardiac arrest care is the final link. After the person is resuscitated, medical professionals work to stabilize the person's medical conditions, minimize complications, and diagnose and treat the underlying cause of the cardiac arrest. The pediatric cardiac chain of survival is slightly different from the adult cardiac chain of survival. Because cardiac arrest in children often occurs as the result of a preventable injury, such as drowning, prevention is the first link in the pediatric cardiac chain of survival. The second link is early CPR, and the third link is activation of the EMS system. Just as in the cardiac chain of survival for adults, advanced medical care and integrated post-cardiac arrest care are the last 2 links of the pediatric cardiac chain of survival. Medical professionals can provide the knowledge, equipment, and medications to continue the life-saving care you have already given. In a cardiac emergency, when every second counts, responding quickly using the 5 links in the cardiac chain of survival can mean the difference between life and death.